And when I was thinking about the myths of trichotillomania and skin picking, I was thinking about kind of a way that I practice that's a little bit different than the way that that a lot of people in this field tend to practice. What I've noticed in reading other literature and going to trainings with other professionals through the Trichotillomania Learning Center is that a lot of professionals view the behaviors as just a problem to get rid of. And so if it's just a problem to get rid of, the focus is going to be on the symptom and controlling it. And then success looks like getting rid of it. For me, what I found is that we learn a lot about ourselves if we can look at some of the unmet needs that the behavior is soothing. So rather than taking it away from clients, I really like to understand it deeply and help clients to respect what it has done for them in their lives, because it has helped them to cope in many ways with maybe sensory difficulties and whatever difficulties get piled on top. So one of my clients framed this issue in a beautiful way. She does both the picking and the pulling, and called these behaviors combined her blanket with thorns.
Oh, wow.
So powerful, and it makes it so clear. Nobody wants their blanket to be torn away. And I don't want to tear away anybody's blanket. I want to help somebody look at, why is this blanket so important to me? And then I also want to look at, how do these thorns affect me? You know, what's the balance here? Is it helping me or is it hurting me? And where's the balance? And then when there's enough understanding of what the needs are that are being met, and we can find other ways to meet them. Maybe it's related to an anxiety that goes through your head, and you're running through all your anxieties, and if you write them down instead, it's another thing to do with your hand, and you're not going to your hair, and it doesn't have the negative side effect. But that's very different than just trying to get rid of the problem. And that way, it also helps. What I found is that a lot of people come to me after going through a very strict cognitive behavioral program. And they may have gotten rid of their behavior, but guess what? Another one popped up in its place. Overeating tends to be a great substitute for picking and pulling, and I'm not interested in substituting one out for the other. What I do find, the good news is that my clients, if I can work with them at healing on a deeper level, the progress we may find, which might be stopping completely, more likely it's going to be that we always know we're going to revert back in times of stress, but we can reach a manageable level where we have some control, and then I find that my clients are more likely to sustain their progress.